Knee monoarthritis. Three important differentials: OA, gout and pseudogout. How do we differentiate? Let me give you a simple solution. Well, let's look at the population or the age group involved. In OA, it is going to be a disease of the elderly population, and so is pseudogout. Gout is commonly seen in middle to older aged males and in postmenopausal females. When we look at the joints involved, OA is typically seen in the first carpometacarpal joint, the PIP and DIP joints of the hands, and also in the knees and in the hips in the lower limb. When you look at gout, the most common joint to be involved is the first MTP joint. And in pseudogout, the most common joint to be involved is going to be the knee. OA is largely seen in older population, in obese individuals, and also in individuals who overuse their joint as a result of their occupation or who have sustained a joint injury. Now, when you look at gout, gout is commonly seen in patients with metabolic syndrome who use diuretics, alcohol, and also in CKD and heart failure. Pseudogout is common in metabolic conditions like hyperparathyroidism and hemochromatosis. X-ray shows osteophytes in OA, it shows tophi in gout, and it shows chondrocalcinosis in pseudogout. But the most important investigation in any monoarthritis is going to be the synovial fluid aspirate, because that helps you to rule out the fourth or rather the most important differential in any monoarthritis, which is septic arthritis. So read the caption below if you'd like to learn more about this topic.